We first of all start with our reablement assessment to find out what their SMART goals are. We then try and ask them what they want to achieve in this reablement period. We upload them onto our digital care plan, and these are reviewed every 2 weeks to see that this person or this individual is achieving these, and if we can support them and help them if they are not actually reaching their goals. So when we're completing the assessment, we will try and involve the individual as well, obviously if they're able to explain and talk to us, so they feel part of the care plan. And if there's a family member there as well, we will ask them certain questions. So together with the individual and the family, that they know what their aims are and what we're heading for. It's personal centred care. It's not working for them, over them. We're working with them. We explain to them how we can help them get to them goals, but obviously keeping their independence and letting them do as much as they can themselves. The lady that we had that was having family was explaining to us, daughter done the care in the morning, said that she was struggling with her mum taking her medication. She wasn't taking it, she was crunching it in her mouth. So we explained to her that she can't be crunching her medication because it needs to go down into her stomach. And she said, have you got any advice? So we explained the SALT team. She asked what they was, so we explained. So we said to her the best thing to do is to ring the doctors and get a referral for the SALT team to get put in place, which she did, and she was very grateful. We can refer people to our mental health teams to get the support put in place if that person hasn't got that already. And we can advise them and let them know what support they will need going forward. We always say, if they haven't got a care line in place, it's a good thing, because family members can then go out, and if something was wrong, they can press it, and then obviously the care line will get in touch with the next of kin or the family member, and they will be able to come back. But it lets that other family member go out and not have to worry that person can't be left. So we find care line really good.
Our reablement ethos is to successfully reable that person independently back to the community. By all the means of using UCRT, district nurses, physios, all of those people, to make sure that at the end of that 6 weeks they're confident and that they can just continue living their lives as independently as possible. I'll complete an assessment. This is normally done through looking at a discharge paper, so I can get a lot of information off the discharge paper regarding their medications, what they was in hospital for, any previous medical history. I will get them up and see what their mobility is like and how much support they're going to need, whether that they can get on and off a bed, whether they're able to get on and off a commode. Sometimes I go in, there's no equipment in place whatsoever, so I will ring UCRT to see whether they can support with equipment. That could be anything from profile beds, wheeled commodes, static commodes. On occasion, you can go into a customer and they're on the floor. Use the helpful assessment to determine whether it is safe for us to be able to use the razor chair. If having completed that, it's all good, then we're able to pick that customer up off the floor. Right, signposting people to be able to access the community is very important. They're looking for a gardener, they're looking for a hairdresser, Meals on Wheels. It can literally be anything. And I met a lovely lady, and she was 91, and she said to me that she just felt like she was giving up now. And she used to go to a local church with her husband, but since he passed away, she stopped going. So I rang the church and spoke to a lovely lady and explained a little bit about the customer that I was going into, and she said, yeah, we can help. Well, we can arrange, we can get somebody, hopefully that remembers her still, can come out, they can have a cup of tea with her once a week, maybe even we can bring her into the church, get somebody to pick her up so that she's got something to look forward to.
Re-enablement is short-term service, can be up to 6 weeks, and the aim is to help this person become as independent as they possibly can. Specific and realistic goals, as in getting the person, like person's mobility, so they're able to get around without needing assistance from a carer. We aim to prevent the individual's deterioration by potentially involving district nurses, physios. The urgent community response team are there to stop readmission of an individual and also to especially if they've deteriorated, and they can put things in place to help them. They can come around and do blood tests, urine tests, get medication, get a GP appointment quicker. I always ensure that the individual is involved in any aspect of their care and take into consideration their feelings and their thoughts. Example of someone that we've cared for who was in emergency accommodation, there was really nothing in place for her. There was no like entertainment, there was no magazines or radio or anything. So I was able to get £160 ASDA voucher for her from the local authority, and I went and done her some shopping, got some fluffy pyjamas which she absolutely loved. I gave her a radio from my home, a duvet set, just to try and make the emergency accommodation more comfortable for her, so it enabled her to kind of start getting better and getting back on her feet.